KFI AM 640 live everywhere on the iHeartRadio app. Tiffany Hobbs here with you from 5 to 7. And before we talk to our next guest, I'm just going to preface it with a little anecdote. Most people I know, and this might not apply to you, but it does in fact apply to me, love to eat during this time of year. They look at this time of year as an excuse to overindulge. You have a table full of food, you enjoy multiple servings of that food, and everyone kind of looks the other way because 'tis the season, all right? 'Tis the season for the food and the gathering, but also 'tis the season for the overeating. And then as a companion to that overeating, again, I mentioned this earlier in the show, somewhere around January 1st, people make their New Year's resolutions. And in those resolutions, they vow to take those gained pounds right back off. However, this year and in the recent years, last few years, there's been an additive. There's been a supplement to what we would consider as normal weight loss routine. You work out, you might take some sort of supplement, whatever the case. But now there's been this addition, and the addition comes in the form of pharmaceutical grade drugs, including Wegovy and Ozempic. Last year, Inside Edition, the TV show, did a bit of an expose, and I want to play you a little clip before we bring on our next guest.
Host Chelsea Handler is dishing on Ozempic, the diabetes medication that's widely hailed as a miracle weight loss drug.
It's a miracle. It's too good to be true. Yeah. You can just make people who've struggled with their weight their entire lives thin. It's a miracle.
Handler says many of her well-known Hollywood pals swear by Ozempic.
I've injected about 4 or 5 of my friends with Ozempic.
Can you believe the amount of people in LA that are using
Everyone's on Ozempic. Oh, my doctor, my anti-aging doctor, just hands it out to anybody.
Kim Kardashian and Real Housewives of Beverly Hills star Kyle Richards, who both lost a lot of weight in just a few months, have denied claims that they used Ozempic. Other women are taking to TikTok in droves, touting their Ozempic weight loss stories. This lady says she lost 20 pounds. And look at this woman's remarkable transformation. But Ozempic is not approved as a weight loss drug. It's prescribed for diabetes patients to bring down their blood sugar, and there are serious potential side effects, including nausea, inflammation of the pancreas, and kidney failure. Another reported side effect, a phenomenon called Ozempic face.
All right. So in this expose, Inside Edition, a year ago, briefly told us a bit about the popularity of Ozempic and Wegovy, how influencers like these reality show people are using it for vanity purposes. Because when you look at these people, many of which are not technically overweight, you see a want to fit into a certain type of gown or to be ready for a certain type of event. And these figures, these influencers, these celebrities and personalities are pushing these drugs as, again, alternatives to, let's say, more organic forms of weight loss. This is the miracle, they say. This is what helps them. Well, we have an expert. She is an integrative health expert. Her name is Dr. Swathi Varanasi-Diaz. And she says that with an estimated 100 million Americans struggling with obesity and turning to experimental weight loss drugs like GLP-1 inhibitors, which include Ozempic and Wegovy, could these people be trading pounds for health problems? Dr. Swathi is joining us now to break down the lesser known dangers of these popular medications, and she'll tell us a bit about how we can mitigate the risks. Thank you for joining us, Dr. Swathi.
Yes, well, thank you so much for having me. And to answer your question, you are right. Like these medications have, rose to popularity in the past few years. Ozempic was FDA approved in 2017. And as that clip mentioned, it is FDA approved for type 2 diabetes and specifically for patients who are considered medically overweight or obese. And so, when it comes to their use case, there are a lot of misconceptions around how they can be used. And there's not a lot of discussion about some of the potential side effects and long-term issues with them.
Awesome. So when you think about these drugs, Dr. Swathi, when we think of the risks of these GLP-1 inhibitors, what should the average person be concerned with? Most people are looking for access to these drugs for rapid weight loss. Is it in fact rapid? Is it something that is more long-term? What should people anticipate should they enter into a weight loss program that includes these inhibitors?
Right. So the GLP-1 class of medications, if you are planning on taking it, if you're currently taking it, there are 4 major red flags that I associate with these medications. The first one is gastrointestinal issues. So this is issues to do with the stomach.
Oh, no.
That could be nausea, vomiting, constipation, issues with the stomach, not emptying properly. So that's really the first one.
Got it. And I see that you said that we have 4. Would you mind hanging on with us and we can talk about the next 3? Plus, I have some more questions about you or for you about what people, again, should be concerned with as far as the physical effects on their body and their mental health.
Sure.
Okay, so I'll bring you back after. We have our headphones are straight. We're all good. No more interruptions. You're doing great. And I thank you for being with us here on our show. We have Dr. Swathi with us. She is an integrative health expert. Full name is Dr. Swathi Varanasi-Diaz. And you can find her on YouTube. I looked you up on YouTube and watched a few things of you. You are a star. You can definitely find Dr. Swathi on social media, and she'll share those linkages for you when we come back. And we'll get into some more questions about these GLP-1 inhibitors, which include Ozempic and Wegovy, and answer again the question, could people who use them be trading pounds for health problems? By AM 640, live everywhere on the iHeartRadio app. Tiffany Hobbs here with you till 7 o'clock. We're with Dr. Swathi Varanasi-Diaz, popularly known as Dr. Swathi, and she's an integrative health expert who posed the question, could users of GLP-1 inhibitors like Ozempic, you've heard of it, like Wegovy, you've heard of it, have users actually trading their pounds, their lost weight, for health problems? She asked that question, and Dr. Swathi says, unfortunately, yes. And she was just telling us about the 4 major red flags associated with these drugs. So, Dr. Swathi, I'll turn it back over to you. You got into the very first red flag, and you were giving us a bit of the information there. Can you share some more about the concerns you have for users of these GLP-1 inhibitors?
Absolutely. So, yes, as I briefly mentioned, so the first one is gastrointestinal issues. So this has to do with, any side effects concerning the stomach. So this could be nausea, vomiting, constipation, diarrhea, or even potentially issues with the stomach not emptying properly. And these could lead to chronic digestive problems. That's the first one.
Oh.
The second one is accelerated muscle loss. And what people are not talking about is that when people are losing weight, it's actually the weight loss comes from a combination of fat and muscle loss. And then the other 2 are the fact that, a lot of people, as you mentioned, even from the intro, that a lot of people that are on it, they are actually not supposed to be prescribed the medication because it's not FDA approved for those people or those patients.
Right.
And then the final one are the potential mental health side effects.
Oh, my goodness. So mentally, and of course, people, I think, mostly focus on the aesthetic value or the aesthetic ramifications. They don't want that Ozempic face, or they don't want, I remember seeing something online talking about Ozempic, but there are all these catchphrases and
right.
kitschy names, right? The people are very concerned about how they'll look. But when you talk about mental health issues, what could be a consequence of the use of these GLP-1 inhibitors when it comes to your mental health?
Yes. So one part of it is the part of our brain that helps us, say that we're full now, our satiety center, is actually very close to our reward center in the brain, and they are intrinsically linked. And so, if we are dampening that satiety center or feeling full quicker, that could also then downstream impact, how we have enthusiasm or excitement for different things in life. And so some people have reported that, when they're taking the medication, they actually feel a lower mood, or they feel more anxious, or they have mood swings.
Oh, wow. I think the assumption is you lose weight, you gain happiness. And you're saying not in this case. It could very well impact your stability, your emotional regulation.
And also, it is a personalized thing. So, for some people, yes, this might happen to them. They may feel this way, but it might not be for everyone. And so that's why it's so important that before you go on one of these drugs, that you discuss with your healthcare provider, and especially talk about what is your past medical history, so that they and you can decide as a team, is this the right drug for you or not?
Awesome. So I know that when anyone should take a pharmaceutical, it's best to consult your doctor. You don't want to get into these kind of off-brand or social media influenced versions of these drugs. However, a lot of off-brand GLP-1 inhibitors have been offered. I see them everywhere. I see them on social media constantly in my Facebook and Instagram feed. There's ad after ad after ad for something akin to Ozempic. Oh, take this. It's like Wegovy, but half the price or higher the dosage. What would you say are the risks to taking these forms of these drugs?
Yes, so these are actually what are considered compounded versions. So it is oftentimes the same active ingredient. So in the case of Ozempic and Wegovy, the active ingredient is semaglutide. But the difference is that these are not technically the branded versions. So these are created and often personalized with the dose in a pharmacy. The thing that we don't know is, where is it being manufactured? Some of these companies can be doing it overseas. Some companies can be using different types or formulations of the active ingredient that are maybe not as readily available for absorption in the body, so they might not work as well. Also, the compounded drug market is not as heavily scrutinized or regulated by the FDA. And so if you are interested in the medication, I would say your best bet is going straight to the source and getting the FDA approved branded product rather than compounded.
Got it. So if people should choose to follow up with you to gain more information, to learn more about the other areas of study, the other areas that you are an expert in, you're integrative health expert, and your expertise does transcend Wegovy and Ozempic. You talk about quite a bit that I saw. Where can our listeners continue to follow you? Where can they learn more about what you do?
Yes, so I'm most active on LinkedIn, where I serve as an advisor and medical advisor in particular for different brands like MYOS MD, where on LinkedIn and in webinar format and also on YouTube, I host a lot of educational seminars or webinars for patients, but also for healthcare providers on longevity and muscle health. So you can find me on LinkedIn, find me on YouTube, and also more information on myosmd.com. So that's MYOSMD.com.
Got it. So again, that's LinkedIn. That's Dr. Swathi. Are you going by your full name, Varanasi-Diaz, as well on there, or is it just Dr. Swathi?
You can find things under both.
Okay, awesome. So Dr. Swathi Varanasi-Diaz on LinkedIn, YouTube, MYOS MD. Dr. Swathi, you have been a wonderful guest. Thank you so much for bearing with our technical difficulties. You are extremely well-versed on this topic, and I appreciate you sharing the information, especially at this time of year when people do overeat and then look for a resolution on the back end. Thank you so much for being with us, Dr. Swathi.
Absolutely. Thank you so much. And it has to be, losing weight is a lifelong, journey. And as long as, we can do it in a way that's going to be sustainable and helpful for people, then I'm all in favor.
I agree.